Good evening. Welcome to Stay Tuned. I'm Casey Nolan, and if I could, I'd like to speak directly to my parents for just a moment. Mom and Dad, thank you for watching. I know you think the show is just for the young folks, but it's for you too, especially tonight. Mom, I know you're on Facebook a lot, and you have a Twitter account, so I expect to hear from you during the show. I'm sorry I haven't called. Please stay tuned. People are living longer than ever, and as life expectancy continues to grow, so do the challenges. Experts say while many tend to think about the financial aspect of retirement, they don't fully understand the implications of their changing health care. For many, Medicare can be a confusing alphabet soup of choices. Part B, Part D. What does it all mean, and how will the Affordable Care Act shake things up? How do you plan for the future for yourself or a loved one with a changing healthcare system? Tonight, we've got these answers and more, so stay tuned. Okay, I was talking to my parents just a second ago. You may have not heard what I had to say, but social media plays a big part in tonight's show, which means you play a big part. So please, if you're on Twitter, find us at hashtag, that's the #, Stay Tuned STL, or find the 9 Network Facebook page, and we want to hear from you there as well. What you have to say is going to inform tonight's conversation and really drive tonight's conversation. So we're looking forward to hearing from you there. Hopefully we're fortunate enough to see 2050. I think that graphic right there shows you why tonight's show is important. To start us off, Dr. James, call me Jim, Kimmy, we appreciate you being here, Executive in Residence from the Department of Health and Management Policy at St. Louis University. I guess we should start maybe with some definitions. Who is a senior? What is there? How is that defined?
That's probably the toughest question you're going to ask, because the definition changes over time and it depends on what factors you're going to use. Age. Everyone thinks age. 65 for the senior, 50 AARP thinks you're senior, and they'll send you some promotional material.
That's too young.
But there are also social factors, cultural factors, medical factors, physiological factors. So who's a senior, you can't really define with numbers. Every case is individual.
So if that's kind of changing, are the issues changing? Do you consider yourself a senior?
Oh yes, I'm very senior.
Okay, fair enough. Congratulations. But this is an issue that you've been working on long before anyone would have called you a senior, I believe.
Yeah, that's true.
So tell me how you've seen that change.
Well, you know, to say how long I've been working on it, I remember when Medicare and Medicaid were passed, so I've been working on it for
about 45 years ago.
About 45 years ago. And I think what's changed over time, many things have. You cited one when you talked to your parents, Facebook and Twitter.
Right.
Social media has brought some change, but that's at this end of it. At the other end of it has been the opportunity for people to get coverage that they didn't have before Medicare. Medicare has changed itself. It's covering a lot more people than anyone ever thought it would when they set the program up. We have an aging population, so that there's going to be a bulge even bigger in Medicare. So what's really changed the most, I think, is cost of all of this. And it's not cost of the programs as much as the cost of health care, of medical care. We've seen that, you know, we've had a lot of technology, a lot of technological advances. We have a tendency in this country to say because we can, we must. And so we use a lot of technology. It's very expensive. and it drives up insurance costs, it drives up the cost to individuals, it drives up the cost to the government. So we're in a spiral, it's an upward spiral, and it's a dangerous spiral. At the rate we're going, if you project out, say 20 years, 100% of the gross national product go to healthcare. Now think about that. That means no balance of payment problems. It means no international relations problems, because we got either you're going to be sick or you're going to be taking care of the sick. Now that's impractical. So things have got to change. We've got to get control of the prices for healthcare, and we've got to get healthcare to more people. Probably the biggest change, other than the Medicare program, has been the Affordable Care Act. And the Affordable Care Act is providing an opportunity, not the one I would have wanted necessarily, or not as broad as I might have wanted, but it provides the opportunity for millions of people who have not had access to But I think right now we're at the best place we've been in those 45 years.
Well, that's encouraging to hear. Let's kind of move to the individual. What should the individual be thinking about as they are moving into the senior range?
Well, there are a lot of things to think about. I think, the thrust tonight is to think about medical care and how you get access to it. I think probably more important as you move into this area is what's my social life's probably not the right term, but how am I going to live? How am I going to cope? What kinds of things am I going to do to stay alert, keep active? Those are really important. What kind of preventive programs can I take part in? What will I do to keep myself healthy? Because health is probably the thing that people in this population need the most and value the most. And so I think that's a very important issue for them.
When should you be thinking about these things?
Can I say kindergarten? Kindergarten.
Okay, there you go.
Yeah, kindergarten. There are a lot of things that we don't do very well. This is a very obese country. We have obese children. We have obese adults, and that adds to the costs of the system. But I don't worry so much about the adding to costs. It adds to mortality and morbidity. It hits the quality of life, and I think that's the critical issue.
Okay, so if AARP says 50, let's just use that number. How much do people over 50 really know about their health care and what's ahead?
Not a heck of a lot. Every survey that's done just shows abysmal ignorance about what's going on in health care, what the opportunities are in the Affordable Care Act, what's going to happen to Medicare as a result of the Affordable, all of those kinds of questions come up, and people just don't know the answer. Now, one of the problems is, and probably the biggest problem for the older population is, they have been subjected to the biggest bunch of bull in terms of disinformation about this legislation. They've gotten disinformation from political parties, they've gotten disinformation from people who make a profit from healthcare, and so where do they turn to get good information? Who do they believe?
Stay tuned, I hope.
Well, that's I hope the setup for the evening.
Okay, very good. Thank you. Well, that's our goal tonight. We appreciate you being here, and don't go anywhere. We'd like to talk to you at the end of the show as well.
Very good,
Dr.
Casey.
Jim Kimmy, thank you so much for being here. Let's go to social media and see what some of those questions are already. Okay, we'll stick with the number of 50 and go up to the age of 64 and talk about some of those younger seniors in this first round table. Let's do some introductions. First with Emily Bramer. Welcome back to the show. We appreciate you being here. We're the Bramer Conley, an insurance broker. Also James Tufel, Oasis Institute. Thank you for being here. And Dee Forshee, with Ming Senior Services. Thank you all for being here. So what about it? Tell me, what do people mean? For instance, I've heard something called the sandwich generation. Does that ring a bell with anyone, and what does that mean?
Absolutely. There are a lot of people right now who are in a tough position where they have kids that they're still taking care of and supporting often into their 20s, and then they also have parents who are older that they're having to take care of as well. And it really stretches the finances for somebody in that position. It makes it harder for them to save for retirement and harder for them to prepare for healthcare costs that are ahead. I think it keeps people working longer.
Agree? Disagree?
I absolutely
Do you
agree, yes.
Are there unique challenges for that? I said 50 to 64. People younger than 65, but that might be facing some of these issues we're talking about. Are there some unique challenges there?
So I think some of the key issues we see emerging as affordable care rolls out, some of the issues that people hear in the media are the exchanges. And what does that mean? So this 50 to 64-year-old population, they're not old enough or eligible for Medicare unless they have a disability. And how do they engage in the exchanges in a way that will be productive for them, and how do they learn about the exchanges? Right now we have about 140,000 people just in that age group in the state of Missouri who are uninsured. To put that into context, that's about 3 consecutive days of filling Cardinal Busch Stadium in a row and still having 10,000 people outside the door waiting to get in.
So if we think everyone in their 50 plus has got it all figured out and they've not come across any situation or circumstance that leaves them in that category, that would be wildly inaccurate.
I would say absolutely. I mean, when I talk to people, because I work primarily with employer groups, but with individuals as well, and when I talk to people who are looking forward towards retirement, they often have a lot of confusion, a lot of questions. Education is really key, and sometimes they wait until they've already made that decision. They've already informed their employer that they're leaving before they start getting involved, having a good conversation with a professional. My professional association, the National Association of Health Underwriters, has a Find an Agent tool on their website, nahu.org, which is a great place to find somebody who is a licensed professional who can help you figure out this planning. Because, for example, do you want to take COBRA? Do you want to be an exchange? Do you want to buy your insurance through the private marketplace? There's so many options, and folks need to kind of get a handle on what those are and what the costs are before they make that leap. And I think one thing that comes up a lot of times is the COBRA issue, particularly as they transition to 65.
Right, it's very important that they look into those options that they have before they turn 65, before they decide to retire. There are things that you can do if you're on a group plan. You can either stay on your group plan or you can go into what I call the street products. But it's all about...
That sounds so risque.
Well, sometimes it's better to stay on COBRA. It depends on the price.
And COBRA is, I think probably most people's experience with COBRA is changing jobs, but you're saying it can be used
COBRA
here.
is an extension of your group plan. So if you're no longer an active employee, you can stay on the group plan for up to 18 months. And what some seniors have done in the past, and this is kind of a loophole, is they don't enroll in Medicare Part B when they turn 65 because they're still working. They're working for a company that has 20 or more employees, so Medicare is secondary. And so then they retire, go on COBRA for 18 months, and they don't have Medicare Part B. That's kind of been a problem because if you don't enroll in Medicare when you're first eligible, when you turn 65, and you don't have what's called a qualifying event, then you have to wait for what's called the general enrollment period.
Okay, I'm stressed out just talking about this here.
There's a lot of options, there's a lot of decisions to be made, and I think what Emily's trying to say is that to drive it home is to be educated, get educated, find an agent that knows Medicare, knows the under 65, or the 65 and up, because those are specialized.
Dr. Kimmy said, think about these things in kindergarten. Most people are, when are most people thinking about these things, and is it too late at some point? I don't know. Help us. Someone reassure me. I'm officially not going to retire because it sounds too stressful.
There are certainly ways to change the cost curve, as people say. One of the unique elements about this particular age group is this is what separates the United States from a lot of other nations as far as per capita cost in healthcare, or per person cost in healthcare. That 50 to 60s age range is where we really see those costs starting to pick up in the United States. And to get back to Dr. Kimmy's point, a key is to not look at this as an intervention. but to look at it as prevention. So how can people or how can organizations change environments and lifestyles to make health better?
Go ahead.
Oh, absolutely. I think a lot of companies are looking at wellness programs to reduce their costs. But I think what's often missed is that the average American can have a really big impact on their own costs by pursuing wellness, by improving their own health. I mean, you can take on a bigger deductible, you can afford to have different kinds of choices if you are improving your health and avoiding developing chronic disease.
Something we've talked about on this show before in another context is the phrase job lock, where you don't leave your job because of your insurance.
Because of your insurance.
Do you see this in this age group we're talking about now, and what's the effect there?
That's exactly what happens. They know that they can't get health insurance on the open market because of maybe a health condition, so they stay employed so they can have health insurance.
Or they could get health insurance on the open market, but they don't realize what the cost is because they've been used to seeing only their contribution on their plan, and they're not aware of what the whole cost is. We were having sort of an interesting conversation earlier about this term COBRA. It amazes me how many times people will say to you, well, COBRA is so expensive. They think it's a thing, and it's not. Of course, it's a law that just allows you to continue on your group health coverage. But there's a lot of misinformation out there, and I think it's because most people have worked for an employer, been on an employer plan for so many years, they've never really had to explore any of these types of choices and issues. And I think that what's happening with healthcare reform in the exchanges is going to expand that.
Talk more. Go. I want to know more about the exchanges because we just kind of barely scratched the surface there. What else should we be talking about for this age group?
So some of the interesting issues related to the exchanges are that people can't be discriminated against as far as their premium cost or healthcare costs due to a health issue or disease, which is very different than it was in the past. So this issue of job lock should become a little bit less of an issue. With people getting involved in the exchanges, part of the key will be people enrolling. And the more people that get involved in the exchanges, the more that it will become more affordable. Some of the other interesting things about the exchanges and costs is that although we can't vary by the health status of an individual, the premium cost can vary by, for example, their participation in a health promotion program. So how do we get people involved in health promotion programs that are effective for them and not simply checking off a box to reduce cost of their insurance?
Thank you all very much. Please don't go anywhere. We have a post show we'd like you to be a part of.
Okay.
Thank you all. We appreciate it. Okay, we had a little tease there. We are indeed going to talk to someone now from the National Association of Health and Underwriters. Marci Buckner is joining us via the Google Hangout. Marci, thank you for being here. And kind of picking up on what we were just talking about with the group there, is that tricky? How is that transition from a group coverage from your job insurance to Medicare?
Right. It shouldn't be too tricky as long as you have that qualifying event that they were referring to, whether it's turning 65 or becoming disabled and under 65 when you're leaving your group plan. So as long as you have that qualifying event, it shouldn't be too tricky to leave your employer sponsor coverage to go into Medicare.
We kind of touched on it just there as well. I mean, I think we've all heard or known someone or have experienced ourselves, especially during the recession, of an early retirement, perhaps before one intended to retire. So what do you do when you're in that period before you have that qualifying event, as you say?
Right, and they mentioned this a bit as well, going into the COBRA program, and then I'll talk a bit about the exchanges since they touched on that but didn't go too in depth with it. And that's something, so HHS has tried to transition into saying marketplaces instead of exchanges. So if you hear those two terms, it's the same thing. Exchanges are the same as a marketplace, but I'll use that term since that's what they want us to say.
Is that just better PR, or is that trying to communicate more clearly?
Reasons, but that's another conversation.
Okay, fair enough. All right, we'll stick to the topic.
Well, going into the marketplace could also be an option for these 50 to 64-year-olds as an individual, and they would be able to, if they have had a reduce in salary or been laid off with employment, and that's why they no longer have the employer coverage, they could qualify for a subsidy within the exchange or the marketplace and received a reduced cost and coverage there. And open enrollment starts for that October 1st of this year, and plans will begin January 1st.
Since you're giving us this national perspective, can you tell us how it's going other places where the exchanges are in effect?
Right. So right now, really the only exchange that's in effect is in Massachusetts, and they call it the Connector. So, and that is only because they have been up and running for several years under the Romney plan that he put into place. So across the country, the marketplaces will all open for open enrollment on October 1st, regardless of whether the state is having their own state marketplace, a state partnership marketplace, or a federally facilitated marketplace. And Missouri will have a federally facilitated marketplace. So the federal government will be running the marketplace in Missouri with some input from the state.
What are some misconceptions that you see when it comes to Medicare?
There are a few misconceptions. I think some seniors think that everything is covered when it does depend on some of your income and what you are able to pay. My mother specifically was enrolled in Medicare this past year, and she had a lot of questions for me, but she asked them after the fact. And I think that's something that was mentioned earlier, was to really plan for this and to see a licensed agent or broker to talk about all the different plans that are available in traditional Medicare and Medicare Advantage. Because my mother was surprised with some of the different copays and things like that that she was expected to pay once she was enrolled. And perhaps if she had spoken with someone about it before filling out the paperwork, she would have been enrolled in a plan that was more beneficial for her from the start.
Okay, so
I'll say another misconception is that everything is covered because of the exchanges, and that's also not true. Especially when people hear about the Medicaid expansion that is in correlation with healthcare reform, but a bit separate than the marketplaces. States like Missouri that are not expanding Medicaid, because that can be a portion that goes in for paying with Medicare. For some of the dual eligibles, since Missouri is not expanding their Medicaid to 138% of federal poverty level, there is still going to be a large gap of those that are not covered. But because there's this PR buzz with Medicaid expansion and healthcare reform rolling out, a lot of some of the lower income people don't know the difference with Medicaid expansion and what that means, and that because states like Missouri have not expanded, that they will not be fully covered, that there will be some responsibility on the individual to put forth some contribution towards their coverage.
So how do the private and the public plans work together? Can they, should they? What do you recommend?
Right. Well, states like Arkansas are trying to do that with the Medicaid expansion in Arkansas, so somewhat close to where you are in Missouri. They are taking federal funds to put towards private plans within the Medicaid market. So that's one way that they're doing it. There's also been a lot of discussion in the Hill and several briefings about Medicare funding and whether or not raising the age for Medicare eligibility should be considered, and if it would be a cost-saving initiative. And this is something that we have seen definitely both sides of the issue play out, and with the statistics that are coming out, there's not a concise answer on how that should be solved and whether the age should be increased. Right now, I don't think that we'll see the age increase from 65 for several years. I think that it's a pretty safe bet it'll stay at 65.
Okay, we've both talked about our parents. What's the one piece of advice we should be giving our parents? Because I know any day now they're going to come to me for advice instead of the other way around.
Yes, this is So this is the first time my mother has asked me for advice. So I'm very flattered. Usually it is the other way around, or I'm the daughter, so I don't have much to contribute. But now that I am in the healthcare field for quite some time, she has been listening to me, and I think that as far as Medicare is concerned, making sure that you reach out to a professional that can let you know exactly what the plans are. There's Medicare Part A and Part B. There's the prescription drug with Part D. There are Medicaid Advantage plans, but there's more than one plan within those, and some other supplemental packages. So you really need to speak with a professional agent or broker that's licensed in your state, and that is a consumer protection. So I know a lot of seniors worry about speaking with someone about their health and disclosing their financial background. But if they speak with a licensed agent or broker, they know that they have that protection, that they're licensed with the state, and they can review your financial background and your medical background and match you with a plan, so your needs will be covered and you won't have other coverage for things that you may not need because of some of the health issues you've had in the past.
Marci Buckner.
So I think this might be another topic for a senior healthcare spotlight, but long-term care is something I would also suggest everyone to talk to their parents about. My grandmother enrolled in it 30 years ago when it was very brand new and cutting edge, and she is definitely benefiting from that now with some in-home care where otherwise she would be in a nursing facility. And so I had a very serious conversation with my mother last Christmas when we decided to have in-home care for my grandmother, and I discovered my mother did not have long-term care. So I would also suggest that that's something that you talk to your parents about and start enrolling in now. I'm enrolled in it now, so like the previous guest said, start thinking about it in kindergarten. I started thinking about it in my early 30s. I have my long-term care. So I would suggest that's also a topic for discussion.
Very good. Thank you, Marci Buckner. We appreciate your time. Thank you very much. And speaking of some of those hidden costs that we may not be expecting, something called the donut hole, Jim Kircher is going to explain that for us.
It's midweek at the 5-Star Senior Center in South St. Louis. The card games are underway. Turkey a la King is on the lunch menu. But Dee McGee was here to talk about the disappearing donut hole.
Because usually I get at least 2 or 3 hands that are doing this, going, I'm in the donut hole.
The donut hole has been part of Medicare since 2006. That's when the Part D prescription drug program started.
Just hit go, and that'll take you right to the Medicare website.
People 65 had to sign up for one of the many plans. They still do. But at some point, the benefits stopped. The out-of-pocket costs for drugs went up. Full benefits would kick in if you could afford to get there.
Yeah. Did you think there were people who stopped taking medications?
I know there were people that stopped taking medications. They had no idea how they could afford them. It literally was groceries or medicine.
Boy, we shouldn't call it donut hole. Those are wonderful, with coffee. It's great. But maybe we should call it the gutter, because you fall in it and it's slimy and awful and you just hope to get through on the other side.
SLU Public Health Management professor Stephen Howard says studies back up McGee's experience.
And they had found that a large portion of people would stop taking their meds altogether when they hit the gap because they couldn't afford to cover it at all.
But that is changing.
So it looks like we're headed in the right direction with closing the donut hole. By 2020, the donut hole should be closed, and then it'll be pretty seamless.
McGee is with the faith-based SGSM network and works with the St. Louis Area Agency on Aging to help seniors navigate the programs and benefits and changes and explain what is and is not happening under Obamacare.
There are a lot of questions, but even more, people need more education to know that they even have questions, to know that changes are coming up. So a lot of what we do is focusing on educating the seniors, whether it's by newsletters or by presentations or even individual consults, helping them to know what's coming up, what changes are there, what new things they're getting from the Affordable Care Act, so that they can take advantage of all that.
I mean, there are other parts of the ACA that are brand new, and implementation will be going from zero to something major, and there's a learning curve. There's a learning curve on anything new.
And it's not just older folks who are affected by the new health care law. A lot of people, including young adults who don't have health insurance, will be going online this fall to shop for health coverage in very much the same way senior citizens have been choosing the right Part D prescription drug plan. Explaining all of this will keep Dee McGee and a lot of other people busy for quite some time.
Then you and I need to talk. We do a lot of education on what's really going to happen. Thank you for letting me take your time.
Okay, we're going to talk more about that.
It's midweek.
Oh, in just a second, we'll talk more about that. First, some introductions of our next table here. Sydney Watson from St. Louis University, health law professor. Thank you for being here. Ron Present with Brown Smith Wallace Healthcare Advisory Services. Thank you for being here as well. And Judith Parker, Alliance for Retired Americans. Thank you all for being here. As I said, I want to talk more about what Jim was just talking about with the donut hole, but I just want to finish up a little bit of a conversation that's kind of been a thread through some of our topics tonight so far, and that is the idea of getting a professional to help you make sense of all of this. Help me explain, understand, is that a luxury? Is that something that anyone can have access to? What do you do if you can't get that?
There are also free services available.
Okay.
The area agencies on aging help people enroll in Medicare. Every year there's an enrollment period that happens beginning in October, ending in December. So if a senior's not happy with the health plan they're in Medicare, they can enroll in a different plan. And we have a lot of free services available to help people do that, as well as going to a professional broker or agent to help with that process.
Okay, thank you. Go ahead.
I was just going to say, they can also, those who use the internet, they can also go on the website to the homepage of Medicare, and that will lay out for them exactly what's offered in the state of Missouri, and they can sit and make, compare it back and forth.
My mother uses the internet, but I'm not seeing any tweets from her just yet, so I don't know, Mom. Okay, what is at risk in this donut hole? What are some of the risks in that area that we're talking about there, where things are not covered? Not taking medication, for instance. I don't know. You tell me.
Health, safety, and the life of seniors. The donut hole was a complete gap in coverage that seniors faced, as was explained earlier, before they were eligible for catastrophic care. One of the important benefits of the Affordable Care Act is we are closing that donut hole.
Not all at once.
Not all at once. By 2020, though, it will be gone, and that's probably the most important benefit that seniors are going to see from the Affordable Care Act.
Not all at once, and not completely. There'll still be a percentage that some will pay too, I believe.
25%.
Right. There's always going to be a percentage that they're going to have to pay, but the large gap between what they couldn't afford before, because there was no real support for it, that's going to eventually go away, as she said, in 2020.
Okay. What else about the Affordable Care Act? What other changes are we going to see in Medicare?
Well, there's a lot of really good changes for seniors in Medicare. Besides closing the donut hole on this, the seniors now have a free wellness visit with their physician every year. That's part of the new thrust towards preventative services to keep people well. There are free, all of the preventative tests are now free for all of our seniors, whether it's colonoscopy, being checked for cholesterol, whether it's being checked for diabetes, etc. Those are all free things. The obstacles to changing the Part D that we were talking about, prescriptive change, that has changed. Because a lot of seniors would go into a program based on what they needed in pharmaceuticals, and 6 months later, the company that they had signed up with would change their list of drugs that were available. So now seniors, instead of being stuck for that period of time without being able to get what they need, they have the opportunity at the middle of the year to change over to a company that gives what they have. There's going to be lower costs for struggling seniors who can't afford to pay for their Part D. There's going to be subsidies to help them pay for that. There is a whole new concept of improved care for seniors, and it's really referred to as the accountability, the Care Accountability Act. What we refer to it as a medical home. It means that all seniors, they have a private physician, their personal physician, but all the other doctors, entities that surround that will be working together so that there will be a very coherent thrust in taking care of that individual in a very preventative way so that we keep them well. That's a few of those, but I want to mention just a couple of others real quick.
Okay.
Because the real name of this law is the Patient Protection and Affordable Care Act. And within Medicare, there are some patient protections that are hardly ever discussed that are really, really important. You know, there's, I will look here, it's the Elder Justice Act, the Patient Safety and Abuse Prevention, and the Nursing Home Transparency. And just real quickly, let me just hit on those. On the Elder Justice Act, for the first time, this law stipulates that we're going to have ombudsman in the state that will not only be able to check out abuse, but will also be able to carry through an investigation and bring people to conviction, if that's what it is. That's important because 500,000 of our seniors are abused in one way or the other within whether it's nursing homes or other type of settings. The Patient Safety and Abuse Prevention is for the first time demanding that those who are hard to work in those kind of entities have to be checked through the legal system to make sure that they are qualified and they haven't been abusers. And then the Nursing Home Transparency Act. Very quickly, you'll be able to go on the website and see absolutely everything about a nursing home.
Go ahead, I'm sorry.
No, you were talking about the idea behind this is also better care coordination. Right. And that's one of the key, what I think are one of the key benefits regarding their healthcare reform. And for the first time, what we're seeing is they've actually changed the reimbursement, changing incentives for those providers to provide greater coordinated care to try to help improve quality and help reduce cost, which equals value.
What you all are working with seniors in a personal way. What are their questions? What are they worried about?
Well, I think seniors have been worried about some misinformation, stories that the Affordable Care Act cut Medicare, and it didn't. We did help finance the Affordable Care Act by reducing hospital Medicare payments by about 1%. But that really strengthens Medicare in the long run. We've been using our Medicare payments to pay for charity care, to subsidize uncompensated care. When we expand insurance to almost all Americans, we won't have to use Medicare in that way. And that means that we'll extend the life of the Medicare Trust Fund. Medicare will be there. It will be more affordable for seniors, more affordable for younger folks like you.
Are you telling me I'm going to get old?
Yes, I am.
That's the plan.
We hope so.
We hope so.
Yeah,
we hope so.
that's it.
Anything else on your radar when you deal with the folks that you're talking to?
Yeah, I think one of the questions that asks is what happens when they need to draw upon their benefits and what are the different options available to them in terms of different types of reimbursement structures. The other thing that we typically get asked is what happens to their providers? With healthcare reform, are they still going to have choice? Will they have as many options regarding their primary care physician or their specialist to go to? And a lot, again, of misinformation that's out there. They will still have their choice of which providers to go to. There will still be options. We've seen a lot of consolidation of independence of a lot of those physicians. We've seen the health systems acquiring or contracting with those physicians. So they may be more closely aligned with hospitals and health systems, but their physicians should still be there.
Thank you all very much. I appreciate your time. We wanted to talk about staying healthy with a unique concept that Anne-Marie Berger from the 9 Network is going to show us a little something called silver sneakers.
1, 2, up, up. 1, 2, other arm, other arm. Yeah, feel the beat now.
If you haven't worked
better
out
look
today,
good.
I'm just going to warn you. This story may humiliate you. No, let's say inspire you to get off the couch and get healthy.
No breaks today, straight through.
At the South County YMCA, seniors, that's men
One
and
more,
women
huh?
65 and
One more.
older, are moving,
Turn
punching,
like that.
and lunging their way back to better health. These are members of the Silver Sneakers,
Okay, routine
a fitness
number 1.
program designed to help older adults retain their independence by taking greater control of their health. Silver Sneakers is available through health or retiree
Yeah.
benefits and offers a gym membership.
And it's really more than a gym membership and being able to go work out. They also have socialization. There's specific classes for Silver Sneakers members. It just really offers them an overall opportunity to either keep up their well-being or improve their well-being to hopefully keep their costs down then for their health plan.
Now we're going to shadow box.
This class, led by fitness instructor Art Bernabo, focuses around aerobic activity.
Aerobic meaning we work the heart, the entire cardiovascular system, with some weights.
Many seniors worry that physical activity may cause injury or increase existing pain. But the reality is they are at a higher risk for health problems that physical activity can prevent. According to the National Institute of Health, older adults can gain a lot by staying physically active. Even moderate exercise and physical activity can improve the health of people who are frail or have diseases that accompany aging. In fact, they say exercise is an effective treatment for many chronic conditions. For example, studies show that people with arthritis, heart disease, or diabetes benefit from regular exercise. Exercise also benefits individuals who are affected by high blood pressure, balance issues, or difficulty walking. Lee Jansen, a recent retiree, spent years afflicted with chronic pain.
I came here, I was hurting. I had problems with my feet. I had some gout problems. I had some sugar problems, blood sugar problems. I was in a shell to where I was always afraid something was going to hurt tomorrow. So I never overdid it, and I always pulled back if I did feel a slight bit of pain.
18 months ago, Jansen, despite his physical limitations and mental apprehension, joined the YMCA in South County through the Silver Sneakers program.
I started out two hours a week and sometimes 4 hours a week and progressed, and I found out that there's more inside of me than what I knew I had.
These classes are designed around enhancing the balance, flexibility, muscle strength, and cardiovascular endurance seniors need, and the safety of the participants, many whom aren't the most steady, is always on Art's mind.
We're always conscious of that. We watch to make sure people aren't breathing excessively, and we watch the number of repetitions of a specific joint. Some people have shoulder joints, knee joints, so we watch repetitions. Capabilities do vary tremendously, so we tell people you do as much as you can. At the same time, I do push them within reason, and they seem to like it.
Come on, we are taking charge of our health. That's what we're doing. Taking charge of our health. Yep.
Some people even come through the door and they say, we're going to have fun today, and that really helps you overcome your fears. When you have fun, you exercise a little harder and you get out of that shell. I feel stronger, my legs are stronger, feet are better. I don't have pains in the feet anymore, and I'm not a jock or anything like that, but I want to stay flexible in my old age. I just want to be healthy. I don't want a pill for everything.
Hey, you guys did good. Woo! You did good. Yep. Very good.
Okay, we're back in the studio now with Dr. Xingyu Li from the St. Louis College of Pharmacy. Thank you for being here. We appreciate it. If not everything can be solved, I think most would agree, by the exercises we just saw. There comes a time when most folks are going to need some medication of some kind, but there might be some reasons why seniors might not be taking their medications. What would that be?
Well, you know, this problem is much more than a senior citizen problem. I think in general, people just forget to take their medications. That's the #1 reason. I mean, take myself for an example. I barely remember to take my allergy medication every day.
And that's nothing to sneeze at.
No, it's not.
Sorry, nothing, nobody, come on.
Other reasons can include, you know, cost. If it's too expensive, they might not fill it. Sometimes patients take a medication, they feel better, they don't take it anymore, and then their problems come back. But the #1 reason is they simply forget to take their medication.
So what are the implications of that? Is this a serious issue?
Oh yes, I mean, patients who forget to take their medication or don't take it correctly can feel worse, they can get sicker, they can end up in the hospital, and this all translates to a greater cost onto the patient and our healthcare system.
What's a word we came across getting ready for the show? Polypharmacy. That might mean a lot of different things, hence the name poly. But what does polypharmacy mean to you in this context?
Well, you know, even in my own clinic, polypharmacy means patients who are on a lot of medications. There's no specific cutoff. It's just that we tend to worry if patients are on 10 or 15 or even 20 medications. Certainly I see that in clinic. And you worry because you have to think about, where are they filling these medications? Are they using one pharmacy? I mean, they should be, in order to avoid, you know, medication interactions, making sure that all the physicians know what medications they're on.
So there's a risk, say, if you get a script at the hospital, fill it there, and then maybe get your regular medication somewhere else.
Yes, because there could be, again, interactions, or they could be prescribing the same medication, not knowing the patient was already on it. That's why I always, sometimes the first question when I see a patient is, which pharmacy do you use? Has your pharmacy information changed? Please use the same pharmacy.
Okay, so how do you combat all of these challenges we're talking about here when it comes to our seniors?
Well, I think something that someone has shared in a previous segment is if caregivers, family members, and patients can be active in pursuing wellness. In terms of issues with polypharmacy, making sure, again, they use one pharmacy, they bring their complete medication list to every doctor's visit, making sure that, you know, if they have a caregiver, the caregiver goes with them to the visit to make sure everyone is on the same page with changes that are made during the visit.
Xingyu Li, thank you very much for your time. We appreciate it.
Glad
Nice
to be
job.
here.
Thank you so much. Okay, I'm told my allergy jokes have put us over time, so we'll be concise. Welcome back to the program. Tori Johnson from SAGE, we appreciate you being back. Linda Dietrich from Lutheran Senior Services, and Barth Holohan, Continuum Care. Thank you all for being here. Let's kind of continue on what we were talking about in Anne-Marie's package there with the silver sneakers, aging in a healthy way. We just saw some of the graphics there. My Uncle George likes to switch his watch on his arm every day and then put it upside down some days, and all of the brush his teeth with the opposite hand. Is there any validity to that in terms of stimulating the brain? Does that have an impact on our well-being?
Certainly, there's studies that show that when you keep your brain active and you do things in different ways and you challenge your brain all the time, that you will maintain a healthy brain. So there is valid reason for doing that.
And that can even continue when you start to become forgetful. Say you get dementia or Alzheimer's. If you're able to continue that stimulation and actively energize your brain and do different things, you can delay the deterioration of your brain.
Mental stimulation, I think technology has a lot to do with that today. And when I see seniors with iPads and smartphones and Skyping their grandchildren, they have learned a whole new skill which has tested their brain and challenged their brain. And those are the kinds of individuals who will age successfully because they're constantly looking at new ways of doing things and learning new things.
And there also, for the seniors who may have an aversion to using technology, when I worked as a CNA for many years, I would work with older adults and I would bring them coloring books or crossword puzzles, things like that. Even simple activities like that stimulate your brain and help you maintain your cognitive functions.
Talk about anxiety. We just saw one of our graphics here talking about the suicide rate of older adults. Are there different anxieties that come with aging?
I think a lot of it, too, I mean, the highest suicide rate is with older men. So a lot of times you're stopping your career, your friends are starting to pass away, and it's very easy for people to just be isolated. And if you don't come out of your isolation and start to get involved in things and realize that you're getting older, and there's things that you need to do to continue to actively be involved in society, then you can really just start spiraling into depression. And we see that all the time.
A large percentage of older adults do suffer from depression, so having those individuals seen by a medical professional, excuse me, and prescribe the proper medications can do a great deal to keeping them engaged. And staying engaged is one of the ways to stay healthy as an older adult. Maintaining those social contacts, creating new social contacts. Volunteering is a wonderful way. I like to call it giving people a reason to get up in the morning, something that gives them some purpose and meaning in life. And if they stay engaged with people and organizations or volunteering in some way, that will definitely help fight off that depression that does happen a great deal with older adults.
Do we have a role to play, the younger generation too, in terms of engaging our neighbors?
Oh, I think definitely. I think a lot of people, most people feel they're going to end up in a nursing home, and that's less than 5% of the population. And so the majority of us are going to need neighbors and friends and family to help us live independent. And we just need to start having that dialogue, because many people are in denial that they're ever going to need help, and the majority of us will need it. And denial is not good, because then you're just being reactive to whatever disaster life throws at you.
Environment does a lot to support people as they age. And if they are in an environment where they do have supportive family, they have wonderful neighbors who look in on them, who check on them, who call them, that is definitely going to be an improvement on their ability to age successfully.
How does the health of our seniors, does that have an impact on all of us, would you say, as a community?
I think so, just because the number one caregiver right now is a woman that's between the ages of 40 and 65, caring for not only her parents that are aging, but also her kids. And that's the group that just really needs a lot of help, and we just need to come alongside and say, hey, you know, it's okay to reach out to get help from outside organizations, because you cannot do it on your own, else you're going to drive yourself crazy.
Thank you all, I appreciate it. I promised I would stay on time, so thank you so much. I appreciate you being here. Let's go back to social media to see what you're saying. Okay, we're back with Dr. Jim Kimmey. We just have a couple of minutes, but we started the show with your perspective, and I'd like to end it with your perspective. What stood out to you tonight?
A lot of good information. I think it was very clear that we need more education, probably more plain English. There were a lot of words used that people weren't going to understand tonight. Part A, Part B, exchange, donut hole. So I think that we really need to stress that plain English part. I think that exchange is a good example. They call it Connector in Massachusetts. This is a farmer's market in which insurance companies come and sell their goods to the people that come to the farmer's market. People can relate to that kind of image in a way they can't relate to the word exchange, which doesn't really make a lot of sense to them. ACA does not cut Medicare. Now, I think it came across in a couple of presentations. I think it's very important because that's been talked about a lot, that there are billions coming out of the Medicare program. There are, but they're coming out of three places. They're coming out of provider charges, they're coming out of fraud and abuse. They've doubled the amount of fraud and abuse recoveries in the last year. And they're coming out of the Medicare Advantage program, which has run 9 to 14% higher than conventional Medicare when it was supposed to be the same cost and provide more services. So there are a lot of things that in that bill. And then the other part of it is those monies are coming out, but a lot of new things are coming in. More preventive services, screenings with no deductible. It used to be you'd have a 20% deductible to have a colonoscopy if you wanted one. And so that 20,
no, thanks.
Yeah,
yes,
different strokes. But so that 20% deductible is gone. They can't charge that. Neither can the private insurers. Those kinds of things to give better access to preventive services are very important. The last point I had, Dr. Watson made a really good point. There are many sources of information. Some are not for profit, some are for profit. It's what you're comfortable with. And if you're comfortable with someone your age.
Dr. Jim Kemme, thank you so much.
Okay.
I got to cut you off so we can get out on time, but thank you for being here.
Sure.
In fact, we'll continue this conversation online, so find us. We'll have a post show online. Okay, my mom officially did tweet us, and 5 minutes ago, so at 9:50, so she got in before the show was over. She said, good information, so that's good to know, although she wouldn't want me to publicly call her a senior, I don't think. She's going to be a grandmother soon for the first time.
Older American is the new term.
Older American, I like that. What, I cut you off, Dr. Kemme. Anything
I'm sorry, I was pretty much done.
Oh, okay, all right, very good. Well, you can be excused. What else did we, you mentioned the jargon, and that's my responsibility. I didn't weed through that well enough, but what else should we have talked about?
I'd like to say something.
Let me see if you got it. If you don't have a mic, I'm going to hand you one of these. There you go.
One of the things that Dr. Key said that I'd like to touch on is you can use nonprofit.
Here, try this one. That one seems to be going in and out. I don't know.
You can use nonprofit or profit organizations to figure out what your choices are and for someone to guide you. And what we were discussing is you might be comfortable with going on the internet and doing it on your own. You may be comfortable with the woman, the older woman at the senior center with a microphone, or you can use an agent. Or you can just call Medicare.gov or 1-800-Medicare. What's important is do what you're comfortable with. There is no difference in the price that you're going to pay. regardless of whichever option those are. And that's one thing that we kind of failed to say in all of our conversations. They're not spending any more for an agent or any less for an agent. They're not spending any more if they do the telephone call and roll over the phone. So
individuals might pay different amounts, but that individual person will not pay a different amount for
because they're using a different type
right.
of way of enrolling in a plan. So that's important.
Anyone else? Yeah. Do you have a mic? Let me get you the mic.
The question, did we not talk about something that may be important related to this? We really didn't talk about, from a healthcare reform perspective, what happens to the providers and their interaction with those Medicare patients, the hospitals, the nursing homes, the physicians, because there is a massive culture change that's required for these providers to be able to offer the appropriate service and measure the quality, and then make that information transparent to those, both the individual patient as well as their family members, who have to have that information to really make decisions. The other piece that we really didn't talk about is the system has changed, and all of us, senior, not senior, have to take more responsibility on our own health. We can't just let it happen. There are financial incentives and financial penalties that if we don't take care of ourselves and participate in our own care and care plan, then we will become more financially at risk.
Is it just me, or is this a lot to handle and a lot to take care of? I mean, when you're working at your job, I guess that's back to job lock. That's why people don't want to leave when they have something set up. But I mean, the American way is to have as a friend of mine says it, a hassle-free life. That's like our goal, right? There's no such thing, I guess. You started to say. So that wasn't a question, apparently. That was just, I just had to, no one's asked me any questions tonight. I just had to say something.
Some of the things that are interesting, building on the point that was just made, there are remarkable systems change taking place as a result of Affordable Care Act. They're moving from a volume-based system of the more people you get in, the more billable hours, the better off you are, to a quality-based system is remarkably different. And so as a result of that, people know that to become a better quality organization, they have to do business differently. Like we've already brought up, for-profit and non-profit companies speaking to each other, physicians talking to other physicians, physicians talking to nurses. And so this idea of integration is going to be key. And how do these organizations do a better job at caring for people both in their communities as well as the more traditional clinical institutions?
Tori, something we talked about last week, you've got your mic on, so you're good, but for those that weren't with us last week, LGBT seniors face a specific set of issues. Can you just kind of address that for us?
Right, LGBT seniors, especially in the aging process, some of the fears and anxieties they may have are not like, how am I going to take care of myself, but who is going to take care of me? Will I need to go into a nursing home or assisted living, and will I be accepted and cared for there without being discriminated against or mistreated? Also, many of the LGBT older adults are aging alone. They don't have any children, they don't have any family members that are close by to take care of them like the average heterosexual person may have. So they have that fear and the limited income. Like I said last week, I believe I said last week, was that the average income for an LGBT senior is between $16,000 and $21,000 a year. So coupled with the higher cost of medication and the higher cost of living overall, it presents unique challenges for the LGBT senior.
Again, stressful. Okay, I'm sorry, I cut someone off, I'm sorry. Did I not?
I was just going to go back and add in.
Oh, hang on, let's get your mic back.
Sorry.
That's okay.
To add on what you were talking about in terms of physicians have to talk differently to nurses or, et cetera. But the big thing we really have to understand is that we are now having those providers, hospitals, physicians, talking to people and providers outside of their system to coordinate care. So it's not under the same employment, it's not under the same ownership structure. They're going to have to reach out to truly coordinate the care to be able to learn how to talk to each other without being able to potentially share in that financial component.
So, okay, go ahead, Doctor.
Yeah, and I think that this point that just came up is a really important one. I think there are three things that will cause the Affordable Care Act to fail. One will be that the cost. I mean, if we can't do something about the cost, well, the charges for care, we're not going to be able to make this work. It's just simply going to get too expensive. The second one is what has been referred to here, and that is providers, and how we get enough providers organized in a way that they can provide efficient quality care And that means new relationships. It means new respect among some of the provider groups who had not necessarily respected each other over the 50 years that I've been around. So those are two important. The third one's health literacy, and we've talked about that a lot here. We've talked about it in terms of literacy about insurance and literacy about medical, but it's a broader concept. And this country is health illiterate. And if we don't do something about that, the Affordable Care Act will fail, because so much of it going forward is dependent on successful preventive programs. It's dependent on people making intelligent decisions about their coverage and intelligent decisions about when to use medical care. So that's three things that could really put this on the rocks.
Can I ask the group one more time, just kind of what I asked on the Hangout, which was, you know, what should I tell my mom? What's the one piece of advice we should tell our parents? I mean, I'll go back to you, Tori, because I kind of left you hanging there on that last bit. But what's your takeaway?
My takeaway was that not just for LGBT seniors, but for seniors in general, I think the more information they have about what is out there available for them, the better. I mean, there are many people that don't even know about some of the programs such as Silver Sneakers. My father, who's 73 years old, he had no idea about Silver Sneakers. He was paying for a gym membership until his gerontologist son calls him and says, "You have Medicare. Why are you paying for this gym membership? Yeah. Call up. You're able to get Silver Sneakers." So I think our seniors just need to be informed about what's available to them.
Education. Okay.
And I would also add.
Oh, here, hang on. Thank you.
Find a primary care doctor you trust and you can talk to and you have a good relationship with. Part of this building better systems of care is that Medicare is going to pay primary care doctors more and is paying primary care doctors more because we've underpaid them in the past. We're making them the center of all of these delivery system reforms. And that's really the place where communication is important. You learn health literacy. You begin learning how to take care of yourself. So find a doctor you trust and make sure that doctor is in your Medicare plan.
Last word, yeah.
The only argument I have is find a provider you trust.
Right.
It may be a primary care nurse.
Yes,
it can
you're
be a lot of other
absolutely
things
right,
other than
Dr.
a physician.
Or
Yeah,
even a pharmacist.
Right.
Or a pharmacist.
We're very
Absolutely,
accessible.
part of the team.
Very good. Okay, well, I think we have to leave it there because we're going to run out of time online as well. So thank you all for being here. Good information says at Kidaloo. That's my mom. All right. Thanks a lot. Stay tuned.
Here's the answer for your mother.